So what I've been doing for the last few years is I've been actually, and I say this a lot, I'm the only candidate, first of all, that's had the management experience to run an $18 million budget and supervise 300 employees. The other candidates are good men. Some of them have served us well in the state of Georgia, but they don't have that kind of management background. I've led literally hundreds of people over my military career and my business career. And what I've been doing for the last few years, and I'm the only candidate that's been doing this, is actually helping taxpayers save millions of dollars on health care and health insurance. I know how to do that. In fact, there's going to be a press release that will be released tomorrow about what we've done in the state of Texas. My work in the state of Texas over the last 3 years is going to result in as much as $500 million in savings over the next 4 years. That's by looking at the inefficiencies and the waste that are in our current healthcare system. Because if we don't change it, if we don't take the initiative, we're very likely to get something from Washington that we don't want. And it's going to be a big, big problem. And the government will be making the decision on who lives and who dies. Now, 3 things real quickly about insurance, healthcare insurance, transparency. Most people in Georgia don't know that we have the second highest tax on healthcare in the country. It's called the premium tax. It's 4.75% on every healthcare policy that's sold in this state. 99.5% of our citizens don't even know that it exists. It's what's one of those things called an embedded or hidden tax. Now we're not going to get rid of that right away. And none of that money, by the way, it's about $600 million a year, goes back to healthcare. None of it. We're not going to get rid of that right away because we're going to work with the legislature to phase it down. But what we can do is that we can ask the insurance companies to put it on every policy statement to every purchaser of healthcare in the state. So you'll see how much money is going to the tax that goes to the state of Georgia. And then if you want to call your legislator, then you're empowered to do so. So that's, again, it's the issue of disclosure and accountability. So we'll shine a light on that. The second thing that we're going to talk about is access. And I talked to physicians and pharmacies. In fact, we were up at Carmichael's Pharmacy, one of the most successful independent pharmacies in the state, by the way. You should be proud of that, right here in your own community. And I'm out meeting with pharmacists all over the state. I've got a goal to be in 100 different pharmacies. And I'm talking to doctors at least 1 or 2 a week. It is really a shame what we have done to our physicians and our pharmacists. We have put so many barriers in between you and me, the patient, and the actual provider of the benefit. And some of those barriers have been well-intentioned, but you know what? They're driving up costs as much as 20 to 50%. Their mandates, their bureaucratic controls. If you think we're going to get less control with Obamacare, no. You're going to be waiting in line. If you're 55 and younger, you will get your CAT scan. It may take 9 months. If you're 55 and older, doctors got to write a memo, an economic study, to prove the economic value of that CAT scan before it's performed. That's the way it is in Canada. That's the way it is in Europe. Coming to America soon, if we don't draw a line in the sand. So, access to doctors is an important issue to me, and we are picking up literally hundreds. I have 500 pharmacists in this state already who've signed on to my campaign. I'm talking about independent, small business pharmacies all across the state. Congressman Dill actually spoke at the Community Pharmacy Association meeting a few weeks ago. Doctors as well. We'll have thousands of doctors that will support us because we're talking about reconnecting the patient with the doctor. And taking out and shining light on some of the mandates. You know, we have 1,900 mandates across the country. In Georgia, we have 65. So they add to the cost of health care. Some of them are well-intentioned, not suggesting we get rid of all of them, but we need to shine a light on them. And some of them we need to get rid of. We have an archaic law in this state. There's one law that, and we're going to look at Title 33. I wish I had brought it in, but it's kind of heavy. Title 33 looks a little bit like some tax codes. That's the insurance code for the state of Georgia. We're going to go through that, we're going to audit it, we're going to look at any outdated piece of legislation and see what needs to go and what needs to stay. One of the laws passed in the 1930s says that if you're an insurance company, you cannot remunerate a policyholder for getting health care. If you do things to lower, if you're walking 2 or 3 times a week, if you're lowering your cholesterol, if you're managing whatever disease state you might have, diabetes, asthma, whatever, if you're doing things that you should be doing the insurance company ought to be able to remunerate you or to lower your premiums even. They can't do that on a group policy in the state of Georgia right now. And I just think that's ridiculous. I mean, this all goes to individual responsibility. That's what conservatives stand for. Individual responsibility. So we'll look at that. The third issue, so we talked about disclosure, transparency. Second is access. And the third issue is privacy. What they're talking about in Washington, D.C., as I know Congressman Hill will attest to, is they're talking about dictating to us what policy and what our policy options are going to be, what we get to choose. I don't think it's the federal government's business what policy, healthcare policy we choose. Do I believe we ought to provide the widest access possible? Absolutely. But the free market should be doing that, not the federal government, in the name of cost control, and that's exactly what we're going to get is the opposite of that if we go this route. So I believe that healthcare is a private decision. Let me tell you what they're doing in Massachusetts. In Massachusetts, they have a mandated healthcare policy. Massachusetts, New Jersey, and New York are the three highest cost healthcare states in the country. Outrageously high. Georgia is in the top three most highest states of healthcare in the country. But those three are the top three. Guess who has the most regulation? Massachusetts, New Jersey, and New York. Go figure, right? I mean, you can't afford to buy a policy in New Jersey anymore. It's ridiculous. So that's what we're going to get. We're going to get a version of that. But in Massachusetts, they mandate you to take the health care policy. And if you don't do it, they fine you. They knock on your door, either through your tax return or they come to your door. I guess it's Acorn or somebody like that. But they find you and they fine you. The first year, there were 94,000 people that didn't take the state mandated coverage. $250 fine. The second year, it's progressive. Democrats believe in progressive on everything, don't they? The second year, $1,000. I don't know what the third year is, but that's what's coming to America if we don't draw a line in the sand. And I'm not giving up. We're going to fight this. Because if they pass something in August, September, October, you need a state insurance commissioner who knows how to do that battle, who knows health care from top to bottom, from bottom to top, inside out. And when they start writing the rules, I will fight every inch of the way to protect the Georgia insurance market from the federal government. We must have constitutional officers who are willing to stand up and say, not on our watch. And if there's enough of us, then I'll be going to the Insurance Commissioners Association and I'll be sharing, because I know healthcare. It's my issue. I know it better than any of the other candidates running. And I'm one of the top national experts on this issue. We can fix it, but we need to fix it right. Now, my mom and dad are my heroes. I'm going to close with this. And Roy, thank you so much for the time. My mom and dad taught me to serve a cause bigger than myself. That was the essence of their upbringing of Gerry Purcell and my brother. There's a scripture, and I do volunteer ministry work. I've been doing it for 9 years in the tradition of my father. I preach about 30 times a year, even while we're campaigning. I have to get a word from God every Saturday, but I enjoy it. It's fulfilling. Jesus said, to whom much is given, much is required. This is America. Much has been given to us. And we must fight the good fight to win the race, to win the prize. And I assure you, Gerry Purcell will fight that battle. God bless you. God bless Georgia.
Thanks,